Алло, привет. Да, я звонил. Я думаю, что там компьютер, который стоит в четвертой аудитории, вещает. А, не надо, я уже в другую аудиторию переключился в 90-ю. Сейчас я там их всех собираю. Ну, я правильно понимаю, что в этом проблема была, да? Ну, ничего страшного, ладно. Зато я догадался, смотри как, не совсем потерянный. Я смотрю, что у меня кадры теряются. Взял, переключился на VPN, взял еще, посмотрел. Потом понял, что подумал, что у тебя там включено, поэтому он и считает, что... А ключи одинаковые, и вот он и путается. А, то есть ключи тоже, если даже ключи это самое тоже бы путался, да? Понял, ладно. То есть все-таки в одну комнату одна трансляция, да, я так понимаю? М, понял. Ладно, все, они уже у меня вон переключаются на эту трансляцию. Все. Да, ничего страшного, забей, зато научились. Видишь, зато много учимся. Это ж опыт, он бесценен. Давай, пока. Dear colleagues, I'll start lecture in 5 minutes, okay? I wait you 5 minutes. I ask you once more. Send a message to our old rooms. I ask you send, 10 students here, okay, nice. I ask you send this link to old chat room and I start lecture, okay? Oh, dear colleagues, now I start my lecture. Okay, dear colleagues, now we start our lecture. Just power supply. I attach my power supply to my phone and we start our lecture. Okay. Oh, I'm so sorry. We have some technical problems. As a teacher, don't stop broadcasting from PC, and our chat room receive two video and audio streams from my computer and from other teacher computer. I am so sorry, and I hope you enjoy from my lecture. Okay, let's go. Today our lecture, Doctor-Patient Relationship. I am Professor Alexander Dvirsky. Communication and treatment. I hope everybody understands. Very important communication is a part of treatment. Very important correct communications. Correct communications improve treatment process. Placebo effect has a very strong connections with quality of communications between doctor and patient. You must understand, due relations between doctor and patient must feel positive emotions. Why it's very important? It's very important because we need a therapeutic compliance between doctors and patients. If patient trusts to doctor, patient be satisfied of on duty. I mean, patients receive treatment and support treatment process. Without trust, it's maybe a serious problems. I pay your attention. More than a lot of patients don't support therapeutical process. Why? Sometimes therapeutical process are so difficult. Sometimes therapeutical process not so pleasure for patients. And patients need like a coping. Patient need coping in therapeutical process. For this reason, doctor must create environment in which patient and doctor has a good communications. Good communications, it's a ticket to the therapeutic compliance. Doctor-patient relations, it's a core of the practice medicine. Why it's very important? Because usually in our life we have communications between two sides, between two persons, between person and society. Personality and person, it's a synonyms. It's our social appearance. You must understand that quality of communications influence to the therapeutical process. Doctor-patient relations, it's a very important part of the therapeutical process. When our communications process take pleasure for patients, it's a very good bridge between doctor and patients. It's open way to the improved therapeutical process. In general, we discuss about some model of the negotiations between doctor and patient. First, it's a paternalistic model. Second, it's an informative model. After that, it's an interpretive model, and it's a person-focused model of the communications. Sometimes this name has a use some synonyms. But in general, we discuss about 4 styles of the communications between doctor and patients. Paternalistic model. It's a traditional relations between doctor and patients. Doctor take roles like a parent, patient like a child. What's very important in these communications? Doctor, it's a father which has a love feelings to patients. Sometimes doctors experience much more high than patients experience. Sometimes doctor has absolutely different point of view. What does it mean diseases and how to treatment diseases? It's like problems between child and parents. Child has lack of experience. Child has a lack of skills, and sometimes child don't understand why they must do something. They not understand because not enough experience and skills, not enough education. But usual child trust to parents and do ununderstandable and do something which not so pleasure for himself. Same situations in paternalistic point of view. Doctor, it's a parents which like often son and he try help to son in future, but sometimes for do something good in future we need do something not so pleasure right now. It's like a situation with our educations. We spend a lot of time for learning. You wake up early in the morning, you have a hard job, but you do everything for receive very positive future. Same situations with medicine. We do something not so good right now. Why we do the things? We do the things because we need a positive future. We need a health in future. But for health in future, we need do something not so good right now. And I hope you understand. Then patients very often do not so pleasure things and trust to doctor's prescription, trust to doctor's skills and prescription. It's do this coping much more easy. In paternalistic point model of the communications, doctor it's a father, patient has submissive role. It's mean in this situation we discuss not about adherence, we discuss about compliance, in which patients only do something which doctor prescribe. Paternalistic doctors, it's an expert and patient accede to cooperate. What does it mean? In this communication style, very important trust relations between patient and doctor, because in this communication style, doctor has much more very high level, and patient must satisfy all prescriptions which doctor do. Clear? It's very important. In this communication style, doctor not explain why he do something. Clear? He don't explain. In this relation style, doctor only do prescription and patients do all prescriptions which receive from the doctor side. It's clear. Yes, it's an autocratic model. What does it mean? It means that doctor it's a primary. In this model, we mean that doctor knowledge much more best than patients. In this style of relations, very often doctor not provide enough information and don't explain of an activity. Patient in this This style, it's a classic communication style. Maybe it's not so fresh communication style, that it's a classic communication style. And patient must trust to doctor. I pay attention. In up-to-date life, this communication style not so popular because patient has of an opinion. Time changing. We must living in the new time. Next model is that it's informative model. In this communication model, doctor provide a lot of information for patients. In this communication style, we explain everything like for patients, and but the choice is left wholly up to the patients. You understand this? I pay attention. It's a very important sentences in this picture. Pay attention to this picture. It's essential of this model of the relations. The interpretive model to make recommendations and take into account to unique characteristic of an individual patient, a sense of the shared discussion making. Doctor present and discuss alternative to find with the patients. I pay attention in paternalistic point of view. Doctor show only one way, and it's a doctor choice. Treatment, it's a completely doctor choice. In the interpretative model, doctor show some ways for patient, and after that show this way has this positive aspect, this way has other positive aspect. Negative, we show negative and positive aspect, and after that patient do own choice. In this model, we mean that patient have a choice, and patients must do own choice. Responsibility, like a doctor only show way, patient do own choice. Deliberative model. Doctor, it's like a friend of the patient, not just by prescribed information. This model very good, my opinion. Why? Because this model open way to the therapeutical adherence. What does mean adherence? Compliance, it's mean patients like a slave, say so. Doctor, master, patient, slave. Patient don't think about doctor recommendations. In this model, patient like friends. We discuss with friends what's so good for you, what not so good for you. We explain what's happy. We show empathy for patients. I pay attention. Model is only like a guides, and usually, yes, of course, we combine between the different model of the relations between doctor and patients. A lot of characteristic depend. Lot of characteristic depend what style you choose. For example, if you use paternalistic style, it's between old age patients and between child. Yes, of course, if you use a style of relations between patients which has a like a medical background, biological background, yes, of course, my opinion, interpretative model much more better. For other patients which has a high responsibility level, which has a high education, a very good model of relations when patients and doctor are friends. Some factors influence to the relations between doctor. It's a doctor factors, it's a patient factors, and yes, of course, interview settings. What's patient's relation factors? Physical symptoms. Yes, of course, a lot of pain, a lot of compliance. A lot of pain, and yes, of course, if patient feel very difficult suffering from symptom very painful, yes, of course, patient be satisfy all doctor recommendations. When we has matter with chronic diseases in which symptoms not so strong but persist long time and patient has habituation to symptoms, yes, of course, in these situations much more better it's a personal it's a style of relations in which like a with centered relation to patients. Psychological factors from patients. If patient has high education level, biomedical education, yes, of course, our style of relations must be like we must take a lot of information for patients. We must explain our activity. For what purpose we do all of these things? We do lots of these things for increase our communications, improve our communications. We need to do our communications more perfectly. We need empathy. We must show empathy for patients. Patient must trust to doctors. It's very important for adherence. Previous experience. Yes, of course, if your patient has previous conflict with doctor, very often is dramatically decrease quality of the communications. Current experience. Very often do correct communications from the first step of this. Doctor factors. First, yes, of course, it's your communication style. How many hours you learning? How many special class you finish about doctor-patient relations? Next, self-confidence. Its ability to communicate. It means your internal ability, your personality. If you like patients feel this empathy. Physical factors, appearance, body language. Psychological factors. It's your person. It's my opinion like a personality, but personality it's behavior. You must understand. Psychological factors, my opinion, it's more deep. It's like your internal relation to patients. And your target in these situations create empathy. What does mean empathy? You show to patients that you understand his problems. Sympathy, you feel same emotion like a patient. It's a mistake. You must show empathy. But sympathy is incorrect, because if you feel a sympathy, you be every time solving your patient problems, and you completely destroy your personality. Now, very brief information about interview. First, in interview, it's a privacy. Patient must trust discussion between you and he. It's absolutely close information. Do everything. Pay attention to the confidence medical data. Next, comfortable surrounding. It's a rooms. It's your style of behavior, your interview style. Clear, very important interview style. It's a part of the doctor-patient's communications. Surrounding, it's a furniture. Surrounding, it's a style of your rooms. Surrounding, it's a style of your communications. These very interesting terms, transference and counter-transference. What does mean transference? The process of patients unconsciously attributing to the doctor aspect of important past relationship, especially those with the parents. This is a psychoanalytic terms, and this has a root in the patient's childhood period. And countertransference, when the doctor unconsciously, okay, you understand, it's who do transferring, and now you understand who do transferring and countertransferring. When not countertransferring, when doctors unconsciously ascribe motives or attributes to patients that come from the doctor past relationships. It's mean you recognize these patients like your previous patients. My opinion, it's a mistake. Every patient, it's a unique patient. Clear, it's very important. Countertransference, it's like a mistake. Every new patient, it's a new patient, and you must create a new communication channel between you and patients. This channel must be perfectly. This channel must be very pleasure for patients. You must find key from the patient's soul. Style of the doctor-patient relations. It depends from the psychology of the doctor and psychology of the patients. If patient has a low power and doctor has a low power, I mean low power, patient has low interest into the therapeutical process and doctor has a low interest in the communication process. It's like a default communications. Usually it's a style of behavior in which doctor satisfy over duty and patients satisfy over duty. This point of view, it's like a biomedical point of view. Low patient activity, high doctor activity. Yes, of course, it's a paternalistic point of view. High patients, low doctor. Patient ask often rights, patients ask service. It's a consumerist style of relations. And a very good style of relations when doctor and patient has a high interest. In these situations, we can create a very effective communication channel between doctor and patients. Psychological aspect. Patient must feel satisfaction due treatment process. Next, show a positive impact on the patient health outcomes. Yes, of course, positive relations between doctor and patients improve patients outcomes, say so, outcomes of patient outcomes. It's very good for chronic diseases. Effective doctor-patient communications decrease distress between doctor and patients. Distress from the patient side, yes, of course, but it's a reduced conflict. It's a reduced conflict between doctor and patients. Usual doctor which has a high communication style very often has a very small numerous of conflict between doctors and patients. I pay your attention. A lot of problems between doctors and patients, between clinics and patients. It's a result of the low quality communication. Next, very important, in chronic diseases, high level of the in communications between doctor and patients. It's open way to control chronic disorders. Why? Because in chronic disorders it's a lifestyle, and yes, of course, diseases change patients' lifestyle. And if you has a lifestyle of communications between you and patients in which patients feel pleasure, it's improve control in therapeutical process. Clinical aspect. Good compliance with medical intervention. Yes, of course, if patients satisfy all your recommendations, it's improve your interventions. Less diagnostic test. It's very important. High communications level, decrease numerous of the test. Why it's happy? Answer very easy. Patients provide more information for you. If patient trusts you, if your communication channel, if patients feel positive emotions due communications between you and him, yes, of course, patients provide more informations. High complaints with prescribed medical interventions and associated reduced medical costs. Next very important role, good communications decrease cost of medical treatment. Open questions. What does mean open questions? It's questions, how are you? How matter with you? Closed questions. I have a headache. Empathic. You need to develop empathy between you and patients. What does it mean, empathy? Empathy, you show that you understand patient's problems. Very important, you show and patient must trust to you. Empathy, it's mean completely empathy. It's situations when patients understand that you really understand his problems. But I pay your attention. Empathy, it's not a sympathy. You must, something has a distance between, you understand problems, but you don't feel patient's problems. Clear? You don't reflect patient's problems in your soul, say so. But you understand, your brain or your mentality understand patient's problems. Reading this, my opinion, this information. Open questions. You understand, in these questions, patients explain open problems. Yes, of course, we have other style of communications we can use. I have a headache, or you have a stomach pain, or you have a pain in the joint. Yes, but yes, of course, you must combine all communication style. First, you must listen patient's story. When you use open questions, you improve patient satisfactions, because patient won't explain open point of view, and you must balancing between open and closed questions. You understand, these questions like a restrict patient's answer, and you must balancing between between open questions and closed questions. Reading this text. Summary, very important part in our consultations. Clear? We must we must inject our opinion in patient's mind, and patients very important. Patient must trust to our summary. It's very important. Trust relations between doctor and patients. Normalizing statement. Reading, my opinion, this example very good show what has been normalizing statement. conducting statement as a statement. Yes, now we have a good in example, because explain this so difficult. I hope the syntaxes explain idea of this statement. Next. Okay, for today enough. Thank you very much for your attendance.